So can you guys hear me? Hello?
I can hear you, yeah.
Can you hear me?
I can, yes.
I can't hear anybody. Is anybody there?
Yes,
I'll just
hello?
mute myself again. Can anybody hear me there? My video is not on and I can't see anybody or hear anybody. Is anybody there? Hello?
Hi, Carol. This is Addison with TSD. I can hear you.
Okay, good. Okay. Sounds good. I gotta mute myself again.
Okay.
Let me know if I need to do anything. I don't have a video though. Is that because you haven't turned it on?
Yes, correct. They haven't.
Okay.
I don't believe they've started the video at the meeting room.
Okay. Sounds good. I'll just mute myself and sit here till you need me. Okay, thanks.
Test.
Sang when we were.
My husband was trying to cut a pill into for me. Yes, they ordered a, thank you, Penny. They ordered a half dose, and of course the druggist did not cut them. That's his whole finger down.
Those little pill.
That's what it
Cutters.
was.
I can see people's lips move, but I can't hear anybody. I hear you now.
Hey, all right.
You were red before, now you're white. There's like a light on it.
Do you guys see me at all?
Not at this time.
No.
Because all I have is a big black spot.
Then we have to see if we vote on anything.
Yeah. So I have a question. If our advice is to wear masks when you're inside and have virtual meetings, should we all be wearing masks over there?
No, they're not required any longer.
I'm not trying to require, talking about things we suggest.
Me,
I had mine.
Well,
I took it
you and
off.
I have the same mask.
I have several.
yeah, we
I'm
have
sure you all
them.
have one in your pocket. No. I have one in the pocket of every coat I own.
Your call.
So right now, all I can only see is Penny and Steve.
It probably is
And somebody's hand.
sharp. I would say when he talks, then the camera will move. So
Somebody else talk.
people are talking. Dr. Pritchard, you can say something and see if the camera's, oh,
I
you're on
could, I
the,
could, I could see Steve. I could see Steve and Penny.
oh, it's clearly just, it's resting
What else do you need?
focus. So
Yeah, this is
That's,
no longer chairperson.
since my
we'll
wife's
have her
name is
change.
Penny.
We haven't used those in so
Stephen Penny
long
is-
that
I
we
hear
just
that,
pulled
I've
them
heard
out
that a lot
today.
over the last.
I have not seen the place.
Yeah, we'll have to take you on a tour when we're done.
So George said, George is zooming in too, right?
Yes, Dr.
I use my app.
Dr. Hageman was supposed to join
Like a
by
hot-
Zoom. as-
Park Mobile.
Yeah,
You just put in the number that's on the meter and.
The number on my meter was the same as the number over here. They all said 740 or something.
nope, see, she is on there. You came up on the
Hello
screen.
there.
Real people,
Yeah.
real people.
I know, right?
Yeah, yeah, we need to be careful about I can see you guys, but every time somebody says something, the camera moves around, and so it's like zooming around the room. So maybe we should be careful about talking one at a time.
We're gonna make you dizzy. You're gonna be on the camera?
Yes.
Okay, well, we hope so, because
Our photography club's gonna meet next Monday on a combination Zoom and open meeting at the library. That's gonna be interesting.
Who is?
Photography club, the nature of the group's gonna meet at the library in their room 1B. And we're gonna Zoom that thing if people don't wanna come in.
I don't either. Thanks.
What's up in the packet besides the agenda?
In your electronic packet that
okay,
you
I
got,
got
yeah.
it,
Do you
yeah.
want me to print any?
No,
I
no,
can
no,
print
I
any of
have,
it.
I actually. I got it here.
I can't remember the minutes, but they were out a while.
I
back.
have a copy if you want to
Okay,
look at those. There's a copy.
thank
You
you.
get back in the swing of things now. I did tell Kendra and it's like,
Kate-
well, it's
Kate,
been
did you have
2
any
years since we've
corrections to it.
physically
I went
met.
through them.
I went through them and didn't have any
I
corrections.
went through fairly carefully. And I thought, okay, I don't see any, but let's see what Kate
No, I
finds.
didn't find any. You know why Dr. Tulipian isn't functioning?
No, unless she's got her camera on.
Dr. Talukian,
Yes,
is your camera
my camera is on.
showing that it's on?
Wait a second.
You got the cover on.
I did see her earlier.
There we go.
There you
Okay.
go.
Oh, there you are.
You had a cover on it.
Right.
Actually, it was. I just closed it and opened it again. I don't know what happened there.
And then Dr. Hegeman should be joining us as well. And there is
Not here yet.
uh,
I don't
we
see him
got-
anywhere.
a few minutes yet anyway, so.
Still 3 more minutes.
You get your extra vaccination booster.
Yeah.
It's the only places that the public health department right now. I looked up to find the booster. I was like, nope.
Should be able to get the booster anywhere that gives the vaccine.
Well, we didn't have it at CVS where I got my last booster, but they do have it on Miller Drive.
Right.
So I'm gonna go there and get it.
Yeah.
I have some friends that had to get their appointments over in Brown County to get their booster set up.
I know a lot of people have been, they got lots of calls yesterday, so it may just be that people are,
The rush.
that want, yeah.
I'm gonna hold off myself.
Yeah, I think I am too.
I think I
Yeah,
am
'cause,
till, wait till fall when
'cause
we
we're in a-
start going inside.
Right, we're in a good state, we're in a good place right
Or
now,
until
so
the
save
VA
it,
hits
save it
Indiana.
save it for when
Yeah,
we start to see maybe an increase.
Yeah, that's.
Or
kinda my-
travel. I'm gonna
That's
be
kind of my
planning.
strategy.
I'm gonna be traveling in
That-
June and
I'm
July,
going to
so
the city,
That makes sense.
big city.
When did Japan was there?
Atlanta.
Oh, I thought you said Japan.
I'm
I
going
thought
to
I heard
Vietnam.
you say you're going to
No,
Japan.
Atlanta.
Oh,
My
Atlanta.
children are gonna do it in Japan in a couple of months.
Okay.
That'd be interesting.
Are we gonna, Lori Terrell is actually, she needs to be elevated to a panelist?
Yes.
Yeah, she's signed in. People kind of coming and going
Yep.
a lot in the attendees.
They're probably looking and takes them a minute to see
There
who's
she is.
there.
Okay, all right.
Mark, you want these? Minutes?
Ashley
You
coming?
got
I have right here.
Okay,
Thank you.
I got it. Need to see it? Bob, thanks.
I've got them.
Okay. That's your copy. Did you take those eagle pictures yesterday or today? Or just, are those older? Older, yeah, last year.
So Ashley is not coming, correct?
Correct.
The fish? Yeah, that was on the 446. Okay, that was there, okay.
So Kay and Mark and Steve and Bob are all there. So everybody's here except for George, correct? Is going to be here?
Yes, and Nick Foils from IRA is supposed to
George
That's
said
come.
it's just signed in. He just needs to be elevated to the panelist.
Okay, because I had him as in person, so great. So-
No, George just needs to be elevated. And Amy Meek and Kathy Hewitt are both signed in too, that need to be elevated to panelists.
Kathy
Nice
is,
fish.
looks
Are they-
like,
Hi, George.
The heck with it. I'm gonna just switch to a worm. I was like gonna catch a bluegill just to say I didn't get skunked.
Yeah, we're gonna do this.
I caught that.
next week, a couple of weeks.
So
Combination.
Penny is,
You need to have
Go on the line.
who's our attorney again?
The catfish,
Lee
he was
Baker.
acting like it.
Is he planning on joining?
Jump out of the water.
No,
As
never.
As far as I know, he didn't tell me no.
He had a
Okay.
bait fish in
Well,
his mouth.
it's 4:31, so we should probably get started.
What a part of our life, huh?
Is everybody ready?
Yeah.
Okay, so it's a call to order the Monroe County Board of Health meeting on March 31st. Do we have anybody that for public comment? Hearing none, we'll move on to the approval of the March 3rd meeting minutes. Does anybody have any corrections or changes?
I move
Everybody
that I move they be accepted as written.
Okay, Steve, do we have a second?
Second.
I'll second.
Okay, George is a second, so there's been a motion and a second. Well, I guess I still have to do a roll call since we're not all there, right?
Right.
So we'll start with George.
Yes.
Okay,
Yes.
Mark,
Yes.
Steve,
Yes.
Bob,
Yes.
and I vote yes. Okay, so minutes are approved. So we'll move on to public health reports. Our first report is a public health clinic. I think Amy Meek and Lori Terrell both here, right? Is that true?
Good
Hi,
afternoon.
Amy. I see Amy.
Yes. I don't know if Lori was.
And there's
put in
Lori.
as
I see Lori in her
panelist.
car. I just saw Lori in her car.
Okay, good.
Yes,
Okay,
I
go
am in my
ahead,
car is commuting, sorry.
Okay. Well, good evening. I just wanted to give you a quick update for the public health clinic. First of all, the 50 plus extra dose for COVID has rolled out, and we're seeing an increase in vaccine appointments now at the clinic. Starting April 1st, instead of going to rshot.in.gov to schedule online, customers can just call the office and schedule like they would any other vaccine. And that's how we plan on things kind of rolling out, unless something changes. From here on out, COVID vaccines will just be given at the same time as they're given with any other vaccine. So those
know what the-
appointments are Monday
Yeah.
through Thursday.
Can you tell me what the phone number is for that?
Sure, 812-353-3244.
Okay, so people starting, can they call now or do they have to wait till April 1st to start calling?
Oh, they are already calling, so yes.
Call
they can
now, okay, but just,
Yes.
so, all right, so they can just call directly now. And
Yes.
you still just have Moderna or do you have Pfizer too?
We have everything. We have pediatric, we have adult, we have
Okay.
Pfizer, Moderna, J&J. Yeah.
Okay, cool.
We are continuing our homebound services too. So every Thursday we go out to anyone on the homebound list that is ready for a vaccine. So our nurses go to the home and still vaccinate there. So as that extra dose comes out, people who need a homebound dose can call 211 still and get on that list. And then they send us the list each week. And the last thing I have is just changing in staff. So Carol Wise Kennedy has announced her retirement. So that is our director at Community Health. With her retirement, I'll be stepping into interim director at Community Health. And Lori Terrell is joining me today. So Lori will be stepping in as interim manager of public health. So I'll let Lori introduce herself and maybe she can tell you just a little bit about herself.
Sure, I am Lori Terrell. I am presently the clinical manager of a program at IU Health called Family Vitality, which circles around navigation and care supports for expectant and postpartum moms with substance use. Previous to that, for 30 years, I was the clinical manager for what was Riley, Southern Indiana Pediatrics, now Riley Physicians. So I do have experience in terms of vaccine scheduling and working on some of the other opposite end of what it looks like in the office to deal with some of the communicable disease and rabies and those types of things that we've experienced over the years.
Does anybody have any questions for us?
Doesn't look like it.
Okay, thank you.
Thank you.
Great. Great. Thanks, Lori. I'm just kidding. Okay, I'm just trying to get my thing bigger. There we go. Okay, now I can see everybody. That's great. Okay. All right. Anything else from the public health clinic? Any questions for Lori or Amy? Hearing none, we'll move on to our next report.
Kirk White, IU.
Okay, I'm sorry. I just got a little distracted by activity around me. Kirk, I see you. Hello. Welcome.
Hi. Good afternoon. Thanks for having me again. I'll provide a brief update on COVID at the Bloomington campus. We've seen a continuing decrease in cases. In fact, for the 3 days, the 27th to the 30th of March, we were just down to 4 total cases. And currently, we don't have anybody in our quarantine and isolation facility. Of those 4 cases earlier in the week, 2 were off campus and 2 were employees. But what we are seeing is an uptick in influenza-like illness. As I'm sure you're noticing in the community, 13 cases Monday and Tuesday of this week at the Student Health Center. So we may have more influenza than we do COVID right now. I'm not sure about that, but certainly that's the cases that are being presented at the Student Health Center. Some of our changes, though, because the numbers have decreased so much and because of our high vaccination rate, we're going to suspend the mandatory mitigation testing that everybody's been doing that were unvaccinated. So up to this point this semester, unvaccinated students, faculty, and staff were required to come in and get a weekly mitigation test. We're going to suspend that effective tomorrow, as long as the numbers stay as they are. However, we will continue offering voluntary testing and symptomatic testing. We're going to switch the voluntary testing to really an easier platform. We've got drop-off test kits that we've put together where you do you submit a saliva sample and then drop them off in a drop box. Then our shuttle folks pick those up and take them over to our lab for processing. That will be an easy way for people to access those. And the way to get them, the drop-off kits, we've purchased a couple of vending machines. It's kind of like a canteen, you know, the regular vending machines where you push B1 and the thing falls out. we put we packaged the testing kits in plastic bags, and you can get these kits either at McNutt Quadrangle or in the breezeway there by the Indiana Memorial Union Hotel lobby. And then do your sample, drop them off in a drop box. We'll get them processed as we normally do and get results back to you within 24 hours as we've been running with our own labs.
Are those PCR tests then?
Yes, they'll continue with the same labs we've been using, PCR tests at the Bloomington campus in our lab at Myers Hall. Then we've had a pretty good rollout with the mask optional policy, I think, because we've really made it so that we've encouraged people, if they're comfortable with masks, that they should go ahead and wear them. And so we're going to continue to distribute masks at our building entrances. In addition, the cloth masks that we distributed over the past 2 years are still available. And we have N95s available. Both the cloth masks and the N95s are free to be picked up at the IU Visitors Center, which is right there in the IMU hotel lobby as well. So you go to the Visitor Center, ask for a N95, and we'll hand one over to you. You can get one of those each week, or continue to get cloth masks if you like. And then finally, we know that vaccines are still the best way for us to get out of this. And even though we have a high percentage, we know there's a lot of interest here just in the last couple of days with the new announcement that 50 and over are eligible for that second booster. So in addition to promoting vaccinations and boosters, if you haven't had one, for all of our population, for those over 50 and other immunocompromised, as the FDA has outlined, we will have vaccines available at the Student Health Center for anybody in the IU community, students, faculty, and staff. All they have to do is go to the Health Center website and make an appointment and drop by, and we'll get you in and out probably in 15 minutes for the vaccination at the Health Center. So we'll continue along that path as well. And of course, as I've mentioned before, we're going to keep an eye on this. We haven't packaged everything up and sent it over to the surplus store. Frankly, we've stored a lot of our vaccination testing, all of those sorts of things. We've got them stored in a building. If it needs to come back, we can do that. We'll keep an eye on it. That's my report for today.
Thank you. Does anybody have any questions or Kirk? Anybody? That's great. I love that things are going well over there. I like your plan. Thanks for joining us.
Thank you.
Okay. And then I don't see Nick. Is he's not?
He is here with us.
Oh, he's
So
there.
Nick, you can even pull that chair up to the end there. And Nick is with the Indiana Recovery Alliance. He's the new director, and he is going to give us an update on the work that's been done. And Nick, you can even turn around, the camera will catch you. And they'll be able to see
Oh, that's
you.
amazing. Love technology.
I was going to point that out.
Okay. I thought you guys.
Is there some sort of handout?
Let's see how long it
We
takes.
won't do that to you.
Is
but
there a
welcome.
handout there that George and I aren't seeing?
There is, and.
I like extras to be disseminated to anybody else. who
Great.
needs.
I will scan those to you when we're done, if that's okay.
That'd be great.
All right.
Maybe,
Oh,
maybe if we're going to do hybrid meetings, perhaps we could have, if people are going to be there in person, if there's stuff that's ahead of time, those of us on Zoom can get it.
Yeah, I tried to get
This
the health
a learning
department's-
opportunity.
Yeah, I tried to get a health department email together beforehand, but me and Melanie didn't connect quick enough for me to disseminate it. So that's my fault. I'm sorry about that.
No, we're learning how to do this, not to worry.
My name is Nicholas Boyles. I am the new executive director of the Indiana Recovery Alliance. I'm a born and bred Bloomingtonian. My mother worked DV for 27 years. My wife works at Middle Way House, and my entire family is involved in some social service, service work, mostly domestic violence. I come to this job with every lived experience you can imagine and every reason to keep as many people in this town alive as I can. You know, these are my friends, my people. I grew up here, you know, and this last year alone, we have over 2,400 reversals of fatal overdoses from our Narcan to peer-to-peer reversals. We have put Narcan in as many places as we can. There are now 8 Nalox boxes that I got and helped Danielle put into Crawford House. There'll be more put in Kinser Flats. So as much as we can saturate this town with naloxone to save lives is what I'm planning to do. We just got a bunch of new staff. So when I came in, I just, you know, I needed help. It wasn't something I could run on my own. So we hired some development staff and some outreach workers. We now have 2 outreach workers who are going out 3 afternoons a week to the camps, to Kinser Flats until we can get something more stable out. And any place we see any need, they are, for the most part, not distributing syringes. They're distributing like aid, you know, wound care, naloxone, you know, stuff like that. Mostly as much naloxone as we can pump into this community. We have seen a huge rise in people in our, we used to have about 2,000 to 3,000 a year. We now have 5,000 encounters a year of people coming in and needing help of some form or another. We have referred hundreds to treatment. We started a new pilot program where we get people with HCV or HIV into rapid care through Positive Link. So when they come in, they'll ask about it or they'll have had a test. We send them to a dedicated person who will soon be on site in our building, and they run them through a real quick cascade of care, which is where we lose most unhoused people and people in chaotic use. They can't make the different meetings or something happens. So we're shortening that with telehealth and with an on-site nurse that'll be there a couple hours each day. If we get a bigger need, we'll keep her longer, but we're just going to have to see how it plays out. We're starting a COVID vaccination hesitancy. We got a grant to see why are people not taking these vaccines? Is it feasible? Is what they're thinking right, or is it wrong? How can we debunk these myths that folks think? You know, one person told me Jesus told him not to take it. One person told me that he's scared it's going to turn him into a chimera. You know, another person. So how do we physically, how do we actually debunk these myths for these people? Well, for me, it always worked with science and fact, so that's what we're going to do. We're starting this program as of next month where we'll be going in and taking, surveys. We'll probably survey everybody who comes to the IRA, and then we'll disseminate those with focus groups and try to key into some of the population so that we can then debunk all of these, and get people vaccinated if they need it and start to push this, we're not going to give them, we want you to take it or don't want you to take it. We want you to have the facts so you can make the decision for your own, not based on something you created or something that might not be real. We also started a state program with the state. That's those 3 people that are going out Wednesday, Thursday, and Friday. So the state has partnered with us to get what they call harm reduction street outreach teams out there. And that's what those are. I probably should have said that precluded there. I'm not used to the meetings. As we grow, there's a couple things we're facing problems with. Always funding is always a problem. There's never not a problem with funding, although it's not as critical, it's not as bad as it has been. We were lucky and got a good couple grants that are in. It's never enough to provide what these people really need. We need a dedicated person who will just be there to refer to treatment. Someone to hand walk some of the more harder cases through the whole process where they feel like they're not alone through that. That's something we're looking into. And at some point, we're going to need a new building. Our building has just reached this, it's too small. We're getting ready to do a clinic this summer where we'll have nursing students in learning harm reduction and stigma training in their nursing curriculum. They will learn what problems people who are in chaotic use or people who are unhoused have with the healthcare system, how they can mitigate those, how they can work with those people to get them into healthcare and keep them in healthcare. Something like that, we could probably do it in that building, but it's small, there's very little space there. So I'm hoping you guys will give me your backing to go to the county or to the city or wherever I can find help, into getting us a building. I don't have to own it. It could be the counties or city. None of that matters to me. I just need more space, to be able to treat more people, to be able to get more of these wraparound services that just take space and time. you know.
Do you provide services in that building to people directly in that building?
How do you mean services?
Like, do clients come
So,
into that building?
Yeah, I mean, clients will come into the building and they'll sit down and we'll, you know, if we have to, before we have a nurse coming back to do this, but we help treat their wounds. We talk to them through the testing. You know, when you give someone like an HIV or an HCV test, it can be unbelievably horrible and detrimental if you don't counsel them right after a positive test. I mean, you know, if you're not sitting there explaining them this is not the end of your life, you know, you could give this to someone else. You know, it's not the time to go. Most people, when they get those results, like, oh, I'm dying. What does it matter anyways?
So that's the primary site where that's done, is
Yeah.
in that
In
building.
that little building,
Okay.
yeah.
Got
We
it.
have to close off a room, you know, to do private counseling. You know, it's
Sure.
a small space. Then we also need to do the syringe service program, which is our hallmark, you know, and it's like, if we had enough space to have other offices, we could actually be reaching more of a health hub to these people, you know.
So where actually are you located right now?
118 South Rogers at the old DMV building where I got my first license.
And where do you get your nursing services from? I mean, how does that work? That's pretty expensive?
So what's happened is Positive Link has just donated them to us because they're like a sister organization. We had a nurse that did it for free, Kim Myers, who's a board member. They just couldn't do it anymore with their work and things that had gone on. Any nursing services right now we get are donated or part of some other grant that we're in an MOU with.
Yes.
So like this summer, Greg Carter at Public Health Nursing is going to be bringing those nurse students, and he'll be there to supervise alongside, but so that we can start teaching them ahead of time. They'll also be able to do wound care, you know, small things, you know, that they already have the training for.
Thank you.
Good. If I can keep going. I never know when the 3 minutes is up. I talk a lot. So, yeah. And as you see here, I mean, a lot of these things are just ground marks. We've already surpassed our January and February of this year, have already surpassed our January and February of last year. The other thing is we've never shut down a day. I have not shut that thing down for Christmas. Nothing. 365 days a week, 7 days a week, a year, 7 days a week. I'm there through the pandemic, through every single thing. We never shut down. We provided services when no one was there, you know, and we'll continue to do so with no budget if we have to. You know what I mean? This is something that's a life for me. Like I don't know how I would detach myself from this, you know. It's been one of the culminating pieces of my life. So we are, at least with that, we have a dedicated staff that feel the same way.
Yeah, I have another question, but you talked about referring hundreds of people referred them for treatment. How's that going? Are you able to find people to do?
Here's what's happened. We can refer people to treatment and then they can either come back, and since we don't have a dedicated staff to do that, it's really limited. You know, we don't have much good in the way of easy access to treatment that's palatable because we don't have anybody who can liaise to that treatment. So we can say, hey, ICFR has a quick detox, you know, but then that won't do anything for them for long term because they'll get detoxed, go back onto their situation they were at before, and no support. So we were taking people to Valley Vista. We used to have a dedicated person that their job entirely was to liaise into care, and they were busy every day, taking someone to treatment, picking them up, you know, taking them to IOP or whatever treatment they asked for. We do a lot of referrals to the methadone clinic and to clean slate transitions and groups, which are the medicated assisted treatment places here in town.
So you said you had someone to do this. What happened to that person?
The grant funding ran out. It was a grant funded position.
Oh, okay. So I assume you're looking for another way to fund that.
Oh, yes.
Okay.
We're trying. Yeah, we're trying really hard.
Because, you know, one of the things I've heard a lot about is the lack of availability of treatment programs for people. Is that still the case? Is that getting any better?
It's staggering. So there's one place that's opening up next month in Martinsville. It's Pinnacle. And they're supposed to be this all wrap around, take everybody long, stay as long as you want place. The problem is treatment doesn't work if it's coercive. So like getting someone to want treatment is half of what that person does or to see treatment as an option even, like people usually aren't wanting treatment. They just don't want to hurt or they don't want to feel this way. They don't, it's kind of a shift for them to understand that like, okay, maybe take it piecemeal, maybe we'll go and look at it and see what you think. I cannot tell you how many times we've gone to treatment and they've said no, and we just turn around and bring them back. Then they come back later. Like it's all in the way that you handle people. If you let them make their own choices, they will inevitably choose the positive choice, most of the time. But yeah, there are not good outcomes for people with substance use here in Indiana. We have very few. Most are funded by religious, the religious places that's okay for some people. Some people want that and seek it out, but not everybody does. It's also some of the places are real coercive, they're like, you can't leave now. You need to stay an extra month. They don't get the pay thing, and it's just a huge, huge problem.
Yeah.
Do you
And-
ask, you
go
ask
ahead.
for contributions from clients? Like, I guess there's probably some that could pay a little bit just as a contribution or a donation. Is that something that you have your hand out from for?
So we have a donation box in the front. We only get usually the most I think we've ever seen is $40, $50 in there.
As long as you're trying.
We try, and normally what we do is like, especially during this pandemic, there were people with nothing. So we'd buy somebody food, we'd help somebody out, little things that to everyone else mean nothing, but to a person who's like going through it and can't figure out where they're gonna get the next thing, they might go do something horrible there at that point. $20 to change your day and make you not go do something.
Yeah, that's kind of like a petty cash thing that you can do good with and not have to account for it.
And they come and drop change in. Like it's amazing. You'll see the poorest people give the most amount of money. That's almost inevitably what happens. When they were giving out the stimulus checks, tons of people would come in right after the stimulus check and drop $20 in there. Like our community is amazing. Bloomington this is not the way things are at the places. I hope you guys understand like our relationship with the health department, like our community is special. It is really special. I've been to all these other places. I've been to 4 different places. And they're not the health department and the Surrender Service, the harm reduction organization are not close. They bite each other's back all the time. There's weird kind of feelings. Like we are definitely one of a kind. We've definitely made strides. I'm TAing with people to teach them how to better interact with the health department and how to like stop viewing them as the enemy. So we are definitely a community that is amazing and fabulous, and we just need to take better care of our marginalized people, and that's what I do. So hopefully with all of us together, we can do it. We've recently partnered with the Bloomington Homeless Coalition. We helped them got their 501c3 and, kind of pushed them along a little, and they're now an organization with grant funding, so it's like, it's these little things that may not mean anything to the world that end up being these mountains, and they're out there doing street outreach every day to all the camps, So yeah, it's a great community. I'm sorry, I can talk forever. I love our community.
Hey, Nick, tell us what was the address? So
Oh, okay, sorry. 118
okay,
South Rogers.
I know where it is, but the exact address is one of those things I never know. So
So, but you'd like for it to be a different address.
I'd like, the problem is it's like, we just need more space. We've grown, when it was just one person and one other, and a lot of volunteers, it's okay, but we've grown to like, our need has grown, and it's just a natural growth of an organization that we've reached a point where it's, we have to have a offsite storage just to store some stuff. So we have room to move around, it's just,
So what about your supplies? Are you adequately supplied for all these things that you need?
I mean, we're never adequately supplied. I mean, we are supplied enough. We get by because of, we have some grants that'll keep us by. We are always on the edge, always. It's just there's not all that much funding out there for harm reduction programs yet. SAMHSA had released this thing that was going to help harm reduction programs, but they needed an ESAM, which is ESAM and an ERA, which are federal. You need to be a federal bidder. Well, we've never been a federal bidder, and I don't know that we're big enough to want to do that right now. We're not far away from our mark. We usually end up about $140,000 away from our mark of where we want to be, and the SAMHSA grant was too big. And we had thought the health department, not this, the state health department and DMHA was gonna be able to help, and it turned out they wouldn't. And at the last minute, it was just too big of a lift for us to do, you know. So,
And probably SAMHSA wants it to be a study, right? They want data collection.
they want GIPRA, yeah. They want every piece of everything. It would take my whole job I'd have to hire someone, you know? And I mean, it was we actually, I work with a national group. We gave them assistance for this and talked to them and said, you can't do this. You need to put it through a pass-through like AIDS United or Harm Reduction Coalition. None of these people are going to be able to meet these requirements for these big grants. And of course, the people that will probably get it are these big, federally qualified,
Health centers.
yeah, health centers and other places that have the ability to do that. There's one or two small places that applied with partner organizations, but that didn't come to fruition for us. And I'm not sure that is that bad of a thing. I think the next time they release money, it might be more palatable for people if it gets through a pass-through. We have some CDC funding that came through a double pass-through for COVID hesitancy. Like the grant I was talking about earlier, that came from CDC to NASDAQ to AIDS United to us. And that's why we were able to do it, you know. Yeah, it's mind blowing.
Thank you.
I know what you're doing is really important in terms of the harm reduction part of it. I just am a little concerned about, one of the biggest parts, if we can get people to recover, that's good. I'm just concerned about what's available in the community. And I think it's such a huge piece of what you can offer.
Yeah, so we offer a non-biased harm reduction support group every Sunday night that has no 12 step. People have a hard time with 12 steps sometimes, and so it just is just aid and support. There is no 12 steps, no guidelines. It is just coming and supporting. You know what I mean? And it's been the change for a lot of people. But we need more. Yeah, but there are 1,000 things I'd love to do for this community. We definitely have a huge need. And thus probably needing a bigger place, more money to hire better staff, Pretty soon we're getting ready to hire a syringe service manager, which will lift me out of doing both jobs. I've been doing both jobs until now. So hopefully that'll free me up to do more stuff as well. But you're right. You're right. We are desperately always in need of more services.
Well, thank you for helping our community.
Yeah,
I think you do great work.
Yeah,
I mean, so far, it sounds great.
I appreciate it. Does anybody else have any other questions for Nick? We really appreciate your coming to present this to us, Nick.
Yeah, I wanted to be here in person to make sure you all saw me and knew me. I'm not much for the Zoom meetings, It's sometimes can be disheartening, and I just wanted to make sure y'all knew me and got a chance to either Zoom or not see me and have a face-to-face as it were.
Appreciate it.
Yeah. I will be going to the county I think we're going to go to the county next. Would you guys, you can discuss it without me here. That's fine. I'd like your support to ask for a building. I feel like that's going to be pivotal for me to ask for a building that the health department is saying, yes, we think he needs a building too. You're more than welcome to come and look at my building. You're more than welcome to whatever works for you guys, And you don't have to decide what.
Yeah, what kind of, would like a letter of support be useful, or what would you like?
Something like that. A letter of support, just saying that we support that. I don't know how this stuff works. I've never gone to the county for a building before. Chris had been offered something, and I'm still trying to dig into what it happened, but it ended up not working out. I think it was with a tax sale or something like that. I don't, it's I'm not really sure. Some of those buildings that are around the IU, around the old hospital are coming up for sale or are coming up. I don't know. Kind of staying downtown is central to who we are because that's where everyone can reach us. I really don't know how to do it. This is like the first step that I've made. I've seen locations that I like, but I have done nothing more besides come to the health department first because they're our partners. And I talked to Kathy and Melanie, and then I talked to you guys, and I figured that was like, I didn't want to talk outside of church first, I wanted to make sure that I came to our people first, and then we went from there.
Well, maybe Penny could kind of ask that question is what's the appropriate entity, like, should it go through a health department or should it go directly to the county? Which, and maybe Penny can.
Well,
can-
we did talk about
Yeah.
that, right? Because the commissioners own county property and they're responsible for all the buildings. They are the owners. And then, of course, if there's money to buy something, then that's with county council. So those requests ultimately go kind of to the commissioners and to county council. And what Nick's really saying is he would like to have the support of the Board of Health to say, we support that ask.
Right.
So is just writing a letter of support the best venue? Is there a better way to do that, Penny?
I certainly think having something in writing is a good thing. And then when he's making that ask, and this is something we can work together on, when he's going to make that ask, we can be there as well to stand at the podium and say, yes, we would support that.
So Penny, is this letter something that you and Nick can work out for us?
Yeah,
We can-
absolutely.
How soon, what's the timeline on this, Nick? How soon are you planning on approaching the county?
I mean, I'd approach the county as soon as I could. I don't know how, I think the ones, I haven't looked at their schedule because I was waiting till after I talked to you guys. So I'd probably look at their schedule and see when the next meeting that I could ask.
County commissioners meet every Wednesday, and to get on their agenda is the Friday before. So there's a deadline to request. Now, you could make that request during public comment and not officially be on the
I'd
agenda.
rather be on the agenda.
Right? But you can make the ask to be on the agenda. And so, for instance, if I would say, if you wanted to take next week, we could talk about maybe getting you on that agenda for the following week.
So we could meet
Couple
this week
weeks.
and then next Friday we can come in and put ourselves on the agenda. for
Make
next
that
Wednesday.
request for
I like
that, yeah.
sounds good.
So
Yeah.
for us
Gives
to
enough
get
time.
a letter done, we'd have to do it really fairly quickly, which would mean that we need to pass some sort of motion that we can write a letter and I can approve it without another vote of the board. Is that how that would work?
Yes, you would need to designate somebody to write it and approve it on behalf of the board. So I think the vote, somebody would need to make a motion to designate somebody to write and approve it on behalf of the board. And it could go, I mean, in terms of draft, you can't make any decisions by email, but
Right.
we can certainly send a draft to you and you could tell me if you had issues with a portion before we finalized a draft that went to and it could go to the chair and the co-chair, for example, for approval,
So
or
like-
just the chair.
Yeah, I have, I mean, what's the pleasure of everybody else there? It would seem like, yeah, I would like to be able to give some written support to that.
Yeah, I think that's.
What does
I think
everybody
that's
else think?
appropriate. Yeah, I think that's.
I
appropriate.
agree.
Yeah,
And so what we probably need to do is have someone make a motion that a letter will be drafted and approved by the chair and co-chair to support the efforts of IRA, right?
in
Basically,
obtaining a new building.
and obtaining a new building, correct, okay. Does that sound appropriate?
Yep, somebody would need to make that motion.
I'll make that.
I'm
motion.
listening.
I'll make that motion.
I'd
Thank
like
you,
to
Steve.
second it. I'd like to second it.
I think that was Bob. Was that Bob seconding?
Mark,
Mark,
That was Mark. I can't see anybody. I can only see. Okay, so Steve did the motion and Mark seconded it. So we'll have a vote now, unless anybody has any more discussion. And I'm assuming you trust Steve and I to do an appropriate letter. Okay, hearing none. George, we're voting on the motion.
I
Okay.
approve.
Okay,
Yes.
Mark?
hey, hang on just a second. I think we need the camera to move to see Kay. So Kay, can you speak up and we'll see if the camera will move to you?
Yes, I'll make the motion, yes.
Yes,
Okay.
I see you
Yes.
pop up.
I agree with the motion,
Now,
yes.
now Mark?
Yes, yes, yes.
I see Mark's
Hello.
hand. Okay, that's
Yes.
Mark's hand. Is that close enough?
I can't get it to turn. Hello,
Oh,
hello.
there he
Yeah, there he
is.
is. There you are. There's
I
Mark.
vote
Okay.
yes.
How about Steve?
yes.
Steve or Bob,
I-
either one. But anybody's there.
I vote to approve. Has the camera on me yet? No.
There goes. Okay, there's
There
Steve.
we
We
go.
got Steve.
Yes. Yeah.
Okay, now all we need is Bob.
And I'm Bob,
Speak
and
up, Bob.
I say yes. I
Keep
don't see the
talking, Bob,
camera
so
yet,
the camera will move.
but I
I'm gonna say
yes.
yes too, by the way, but. Hello, Bob. Say something. Keep talking, Bob.
Well, I just tried to comment and look at the camera, but it's not looking at me.
There it goes. Okay,
So
we
by
gotcha.
golly, it's looking
Okay,
at
there
me.
you are.
Yes.
All right. Okay, we got everybody, I think. Thank you. Well, that was fun.
Yeah.
And I thank Nick for his good job today.
All right, Nick, I will get with you and I will talk with the commissioner's office and see when and what process they want us to go through.
I left the extras here. There's 4 of them,
Okay.
and I can digitally send you a copy of it. Just send.
That
out
would
to
be
everyone.
fantastic.
And if you'd like, we can add you. We started doing like kind of weekly or not, excuse me, monthly or bi-monthly. Just here's what we're doing. If you'll give me a set email address.
Just send it to me.
Okay,
and
I'll
I
send
will
it to you
get
then.
Yep.
That's great. I'd love,
Thank you very much. Appreciate
we'd
it.
love to have
Nice meeting
updates.
you.
Thank you, Nick.
Nice meeting you.
Thank you. Thank
Good
you.
luck.
I,
Okay.
I always feel lucky betting on our community, you know? I was a Hoosier kid.
Okay, thanks. Okay, so now we have, is Kathy doing the population health outreach?
She is.
Oh, Kathy, hi.
Hi, good evening,
There you
everybody.
are. Hi.
Yes, I'm here, and it was great to have Nick here tonight. So I'm here to give an update for the Population Health and Outreach Group. First, I'll talk about our tobacco specialists, our tobacco program. So the Tobacco Coalition is currently participating in the STARS survey, or what that is. It's a standardized tobacco assessment for retail settings. And this is a national program. They do it every 2 years. And what they do is they conduct audits.
Kathy, can you talk just a little bit slower? I'm having a little trouble picking up everything you're saying.
Okay, sorry.
It may just be an audio issue.
No, I talk fast and I talk soft. So anytime, just tell me. I will work on that. So the Tobacco Coalition is doing the STARS survey, and that's a standardized process that is done every 2 years. And what they do is they take a 5-page survey into the stores in the community. There's 94 of them within our county, and they look at the marketing, like what's on the outside of the building, what's it marketing to, what's there. They look at the inside, they look at the placement of the products, what's being sold, how close it is being to youth products, or how close it is to the floor, what type of products they're selling. Are they marketing things that are attractive to youth? What is the price point? Is it around $1? Is it something that's easy for youth to buy? So Shauna is working on this with the coalition right now, and she'll be going to 7 or 8 places in the community and completing the survey. So that's something she just started, and she's done 2 places so far. So the Baby and Me program that Shauna also does, she currently has 11 new clients that started just this quarter. And she has a total of 23 clients in the program right now. 12 clients are in the postpartum session and 11 are in the prenatal portion. And she says the numbers right now that she has are getting close to pre-pandemic levels. So that's really good to see people coming back. With our harm reduction program, the big news in that is we've hired our new harm reduction community health specialist. And this person's name is Amy Harrison. And Amy comes to us from Beacon. And previously, before Beacon, she worked at Middle Way. So she has extensive community experience. And that's something that's really—
What'd you say her last name was again?
Harrison.
Harrison, thank you.
Yes. So she came from Beacon and Middle Way, and so has a lot of community experience. So she's a big benefit for our program. So she's currently in our 3rd week, and she's currently shadowing and training with Melanie, who was our previous harm reduction specialist. So on a personal note, Amy is an IU girls basketball fan. So she's been watching the games recently and is a person who loves animals. So she fits in well here in the health department. The harm reduction program has done 7 naloxone trainings since the beginning of the year. And 3 of them or 4 of them are for county offices. They've done 2 for the public defender's office, 1 for probation, and 1 for the youth shelter. They've also done a couple for IU, 1 for the 2nd year medical students, and 1 for an IU fraternity. So a total of 87 people have been trained just through these programs so far on that. And that doesn't count all the people with the regular SSP program. Okay, they're also partnering with our DIS program to offer community trainings at our shelters. So they'll be going to Shalom once a month, and then one of the other overnight shelters another time a month, so that people have an option to get tested for HIV and or STDs at least twice a month at our community shelters. So far she's done 15 HIV tests and 11 hepatitis C tests during 5 visits so far. Okay, and this has really been a benefit for our program because during the pandemic, they had to shut down HIV and HCV testing on the mobile outreach syringe service van while they were doing it, just because of social distancing or lack of. So being able to get in the community and offer these tests has been a big benefit for our residents and for the program. Okay, the last update that I want to give you is we are finalizing our community health assessment. It's pretty much done. We're putting in some final pieces from one of our partners, and then we'll take a couple days just to do some last minute edits and make sure that all of our T's are crossed and our I's are dotted, and then we expect to have it sent out next week. So.
Look forward
Kathy,
to
you
it.
want to update them on the think tank and the plans for that?
Sure. We have one of our think tanks scheduled. That's going to be April 27th from 4 to 6 p.m. Then we're also planning to do another one that will be at a different time and a different location to allow other people to join us as well. We were thinking about the Boys and Girls Club up by Crestmont, but that place, they have found out that Boys and Girls Club is opening on Saturdays now. So they're looking at possibly Banneker and working on that, but we hope to get that scheduled soon. So the second one is hoped to be either the end of the month or the first week or 2 of May.
So that's input for the chip? Is
That's
that what
input
that
for
is?
the chip. What our process is generally we share the information from our survey and our focus groups and the other sessions that Community Voices for Health in Monroe County that they've done. So we'll share all that data, and then people will listen to that and then come to, somebody will lead them and facilitate through prioritizing what the health needs are and then decide on what to work on for the CHIP program for the next couple of years. So
And
we're busy with that and excited.
Is there somebody facilitating all that right now? Like, who's going to lead that?
Right now, Lisa Marie, and I'm not sure of her last name, is who is planning on facilitating, but that's with the help of the Health Department, Parks and Rec, IU Hospital, and the Health Department and Community Voices. So
Parks and Rec.
City of Bloomington Parks and Rec, that's one of our partners.
Yeah. They haven't been involved in prior, I mean, I thought it was just the hospital and the health department, or have they always been involved?
They've always been involved ever since the beginning. That's always been one of our main partners. So
Okay.
Community Voices for Health, Monroe County, that's one of our new partners this year. And so.
Great. Anybody else have any other questions for Kathy? Thanks for joining us, Kathy. It's good to see you.
It's good to see you guys too. And I love the new setup. It's great to see the camera. So how that's going to work. So.
It's actually working really well. I think it's a little slow, but as long as we're patient, it works just fine.
But that means we'll get in trouble if we talk when we're in the room and we're not supposed to be, right? The camera will turn around and face us.
Right. Mm-hmm.
Yes.
It's always
Good to remember.
listening.
Thank you guys. Have a good evening.
Thank you, Kathy.
Thank you.
Okay, so next is Penny, administration.
Sure, just a few updates. We have had some staff move on, so to get permanent positions. So our temporary environmental health position, the Sarah that was in that was doing a fabulous job. She was offered a permanent position, kind of one of her dream jobs. And so she's left us and we're getting ready to review and start interviews for that. We've had a few applications. We have a part-time position. Again, we had someone who graduated and has taken a full-time job somewhere else and left a part-time position. So there's always a little bit of that movement and we are going through that. We just made an offer for the disease intervention specialist position that we have open, and they will be starting by early May. And then we just got some additional money for yet another DIS. So We're looking, it was kind of timely since we were already had a job posted and we're doing interviews. We're just continuing those. And so we'll be able to choose from those candidates and fill that position as well. So we're working with the state and with Positive Link, who we partner and work with a lot anyway, on space and location for them. So we're excited about that. The annual report, kind of like the CHA, we are putting kind of the final touches on that and have had a few revisions that we didn't think would come last minute. So we're putting that together and we'll have that at your next meeting for you, and we'll get that out to you early. So always like to send it out so that you can take a look at it and see if we've missed a typo or if something doesn't make sense, and we can put those final edits before you get that final one to approve. The state annual survey, which now meets our state requirement that's in Indiana code, we're working on that, and that is due in May. So one nice thing is that somehow the state found some money. So every health department this year that submits that will get a little bit of what I'm going to call a little bonus, that we can do something nice for the department, for the staff, whether we use it for a staff retreat or some sort of fun event for the staff outside of work, whatever. There's not a particular limit or stipulation on the use of that money. So we're excited to be able to do that. Legislation, the big lots of legislation that occurred this past session. The two things that are probably most significant is House Enrollment Act 1245. That's the one that's dealing with septic systems and will mean some big changes for us come July 1. It is also requiring that the state change the Indiana Administrative Code, and we'll have to be changing our local codes. That the new law does give us both entities a year to make those changes. However, come July 1, the new law goes into effect. So it simply means that we have a year in which we can change our codes, even though we may not be able to enforce the local code.
I thought it was ironic that yesterday on the front page of the paper, Indiana is designated as has the worst water quality in the whole country. And our state legislature takes another step backwards, just as everything else is going forward, and passes a law that deregulates even further raw sewage.
Yep.
Yeah, I'm just going to go on record as saying I find that extremely interesting.
The other big one is home-based vendors, and it kind of clarifies, opens up a little bit what home-based vendors can do, but it also does require that they submit to the health department their food service certification. So that means that we should know which home-based vendors are out there. So that's a good thing. And again, we're working with the Indiana Department of Health on those. There's also a change to regarding lead.
Is that like food trucks?
No, it would be like a home-based vendor is, say, if I'm making jam and I want to sell jam to you, or I'm making bread and it's supposed to be non-potentially hazardous foods, that kind of thing. But it's been there's been a lot of gray that often happens there. And this does expand their capacity in terms of what they can provide. But so we'll be working through that as well. So all these just, that name sounds familiar, but
She makes our meals once a week.
so, yeah, so there's, lots of changes. One also with lead that lowered officially the blood lead level and our follow-up on cases, and requires for all children to be tested for lead. So we're looking forward to that. And actually there's a little bit of money coming to us to assist in that. And we're planning to use some of that. We can't use it to supplement salaries, but we can use it, for instance, to do an educational campaign. It will help us with our nurses and their case management, and then some of our investigations. So we'll see how next year goes with that, and how much staff time that takes and what we need. But that's one of the reasons that I did mention to you, and this is getting ahead, and we'll talk about this more at a future meeting, but I think it makes sense to request that temporary environmental health specialist become permanent, because we do have these additional things that are coming down the way. And I think that is really what I have. Other than that, the COVID numbers are looking good. The state did change the look of their dashboard. If you haven't been on there yet, that kicked off yesterday, and is really more focused on the same CDC community levels. We're still at a low level, which means that masks aren't required, aren't necessarily needed unless you as an individual feel you need it or want it. But stay up to date on vaccines and test if you are exposed or you're symptomatic. That's kind of the recommendations with that. And that it is really kind of following the hospitalizations and severe infections. So the dashboard does have its own hospital page, so you can kind of see what's happening there. And we continue our conversations weekly with the hospital so that we can kind of see what's going on quickly. And then we're still trying to keep up to date with the water sampling and what's going on with that. So some of that's just being posted, will be on the CDC's website as well. I think there's just a little bit of lag time with some of that.
Yeah.
And that's it.
So the Gravity site is still there though, till the end of April, is that right? Or have they just given up?
Tomorrow is its
April 1.
last day. April
Oh,
1 is
April
its
1.
last day.
Okay, so that's it.
All of them, yes, all of them will be closed by the end of this month. And all of the community sites that were funded through the state. So the state paid for the Gravity sites and they'll all be closed by the end of April. But there are some other community sites, kind of like we had before, and we ran out of money, but some places still had money, and those may operate until the end of June.
So in Monroe County that we're done as of tomorrow then with the community sites.
Yes, yes, there are still, and we have updated the list. Certainly you can still go to the state map for how to find testing sites. We updated the best we could, our local list, and CVS is still the primary place that you'll be able to go for a free test if you need a free test. Still can order them. If you haven't ordered your 2 sets for your household, that can still be done. And then most of our schools, the schools had an opportunity to order take-home tests for their families. And so most of the schools have ordered some of those. So they will be able to send those home with families so that if they need to do a test at home, they'll have tests available for them.
Sounds good. Anything else for Penny? Do we want to just go ahead and talk?
I've got a question. If somebody can update us on the state lawsuits, the opioid lawsuits that now Indiana has become a party to.
Mhm.
That decision was made previously Indiana said, no, we're not going to be part of it. And now Indiana is a part of it. Is that correct?
There were changes. I can certainly have someone from legal department come make to the next meeting and give you an update or.
Yeah,
Yeah.
and of course, those things stretch out forever. These are like settlement issues and it could be years, right? But at least if we're a party to that now, that maybe there's something that will come down the pipe that maybe could
Absolutely.
help some of these
Absolutely.
efforts.
Already been thinking about that as well, and that's a good point. So,
Yeah, it'd be nice. And I've just sort of had half an ear to that, not really paying attention, but it would be nice if we could sort of hear about that.
Right, absolutely.
Penny, also, I've been reading about the variant in the East. which doesn't seem to be down to our area yet. And have you heard much about in Indiana?
Well, if you're talking about
I
BA2,
am.
which, so it is here, it's, I mean, it's in, you know, it's in the United States, it's in Indiana. And it's been here for a while. But it is about, at last I knew, and this could, you know, can change greatly in a short amount of time. Indiana, it was about 35% of our cases. It's over half now of the cases in the United States. Now, it's not seemingly it's still causing mild illness, more transmissible, but it's not increasing, or at least so far doesn't seem to be increasing severe disease hospitalizations.
The state doesn't break it out on the dashboard though. It
No.
hasn't shown up on the dashboard at all.
No, last I heard, it wasn't
yeah.
in Indiana, really.
Well, no, it is, but
But-
the state's not, I guess they're not even testing or
No,
something.
they are doing sequencing. They
It's
still
not showing
are.
up on that bar chart. that
I'll see
shows
if
it.
I can find it for you. I think it's been pretty small.
Right.
Does the regular COVID test pick up BA2
Mm-hmm.
and Omicron?
Yep.
Okay,
BA2 is Omicron.
okay.
It is Omicron. It is just a variant
A
of it.
variant of
Mhm.
Omicron. Right.
It's a
Yeah.
variant of the variant.
Right.
Yeah, I
right.
know. So,
Of the
yes. But I know the state has breakout because they've showed it to us. So I'll see if I can't find that and send it to you. I'm having trouble too. I mean, with the new dashboard, I even had a question yesterday. I'm like, okay, now wait a minute.
Yeah.
These numbers, I've got a question. And they're like, okay, we'll take that back to the team that, you know, your yellow number or whatever is your 7-day rolling average and the other is a month. It's not a week. And just, maybe it was me, but it was confusing to me.
And I
So-
I found the dashboard to be kind of confusing too. I didn't spend a lot of time on it, but I just kind of, it was
There's
not as
a
clear.
lot of information, you know, which is good, but sometimes that makes it harder
Yeah.
to weed through. Yeah.
Before your part is done, I think since you want to get dates for our next several meetings on the books, then why don't we just talk about that right now? You suggested 2 plans. One is every 4 and one is every 5-week meetings. I don't have a strong preference either way. I don't mind having meetings. It's if you have, you know, in terms of what's going to happen. What I really don't like is having, you know, 3-hour meetings. So what do y'all think?
I think 5 weeks is plenty. We used to meet every quarter, and unless things pick up, again, and we have a need to
I agree.
meet sooner.
You can always call an extra one,
Exactly.
so.
So, and I like having them on Thursdays, and I'd rather not have it the Thursday of July 4th week, but, so we could do it the May 5th, June 9th, and July 14th. Does that work for everybody?
Sounds good.
She said May 5th, June 9th, and you said July 14th.
Yeah. Does does that work for y'all?
Yes.
Okay.
Okay. Oh, and just do them again at 4:30 on, and they'll work. How's that sound?
Sounds
That's
good.
great.
Sounds great.
That will allow us to go ahead and get those on the calendar for the public and what have you as well. So,
Okay, sounds good. Would you share that with Ashley too, since she's not
Yes.
here? Thank you. Any old business anybody has? Any new business anybody wants to bring up? Any board member comments anyone has to say? Boy, you guys are dull tonight.
It's nice to talk about something other than COVID.
Oh my gosh,
Oh,
isn't it?
man, isn't it? Yeah, it really is.
Yes, indeed. Okay. Unless anybody has any other comments, I can, we can have a motion. Do we have to have a motion to adjourn, or can we just adjourn? I always forget.
I'll make a motion to adjourn.
Okay.
I'll second.
Any-
Thank you,
Anybody opposed?
Without objection. Thanks, Carol.
Okay, I
for
think
doing
we're
your job.
done. I think we're okay.
Thanks
All right.
IT for getting us all straightened out.
Yeah, this actually, it worked out better than I
Yeah,
expected.
didn't go
I've been
too
in
bad.
other hybrid type meetings without the technology, and
Wow,
it hasn't been nearly as good, but I mean, I don't know what it's like on your end, but on my end, it seems to be okay.
Yeah, that was good.
He wants to keep these-
So you guys can hear George and
Yes.
I okay at your end?
Yes, we can.
Oh, good.
Great,
Okay.
right.
All right,
Sounds good.
well,
All right, guys.
enjoy your
Have a nice
time in
evening.
South Carolina, Carol.
Oh, I'll be here a little bit longer, but I am coming back. Eventually. All right. Thanks, guys. Have a nice evening.
Bye-bye.